It's just sad and it's dangerous that one person can actually do that. You can bring you down so much that you want to die.
The way I felt was that I wasn't a person, I was just this bump. I was just this carrier for someone else who was more important than me.
It's not so much a, wanting to be thin as like an eradication of the self, and certainly I kind of just wanted to get rid of me.
The mental torture, it's scary. It takes over your whole mind, your whole body. He could see what I wanted was just to be loved and to be taken care of and, have a family, and his way of abusing that was by saying no, basically, and making me suffer. I've been thinking long and hard and contemplating whether to post this video. I finally decided, after a lot of thinking, that, yeah, I need to do this for me and my children. I'm 26, I'm from Dublin, I have 2 children. I've been in a relationship for 3.5 years with a guy who I thought was the love of my life. He was the love of my life. I found out he cheated on me when I confronted him. And he denied it, of course, and when I threw his phone, he punched me in the face. And it wasn't the first time. And for the last 1.5 years, I've been told that I'm paranoid, I'm a psycho, I'm nuts, my insecurities will kill me one day. Even up until now, he tells me that my insecurity is going to kill me. You blame yourself. I used to wake up in the mornings and tell myself, yeah, Emma, you need to be a better girlfriend, wake up today, be positive, don't be paranoid, don't be insecure, don't be asking any questions. If he's cheating, if he's texting somebody, don't be asking that, because you just have to have faith and trust. And that alone literally would make you crazy. This is probably when I would have been at my thinnest. I don't know, probably 6.5 stone. I wasn't eating, I couldn't look after myself, and I was made to feel that, why would I want to be around you? Look at the state of you. I completely felt on my own. I was on my own. I would sit here in this house and just cry. And it actually hurts me to even think of that, because it's just sad and it's dangerous that one person can actually do that. You can bring you down so much that you want to die. I finally realised that, no, this is not acceptable. No man has any right to put his hand on a woman. Our lives are completely torn apart. And they're going to know that their daddy hit their mammy. And that's not something that children should see. It was like a moment of madness. I posted the video to stop me going back there, to get me out of that relationship. I didn't know if it was the right thing to do, the embarrassment, the shame of it. So if anyone out there has gone through something similar to what I've gone through, you need to find the courage and get away from anything that's as unhealthy as violence. Thanks. I actually feel so sorry for it. Obviously that's me, but I actually, looking at that, I feel so sorry for that girl that was in that video, because it's just the pain. It brings back all the pain. And I don't think anyone will ever understand, friends, family, I don't think that they'll ever understand the pain that I was living every single day. I feel so sorry for her. And I'm just so happy that I'm not that person. I'm stronger than that.
Emma's video, it absolutely gave women permission to talk. When that went viral, we had an absolute huge increase in the level of contact. So on the following day, we had 48% more calls to the helpline. But also when we looked at our website, we had a 138% increase on hits on our website. Depression is huge, if you're continually being put down. Your sense of agency, your sense of freedom, the sense of there being a point to life is continually being eroded. So that's very, very big. And Ireland is absolutely appalling in terms of the level of counselling that's available to women who are abused. There is ways to change it, but very often it is that you need protection, that you need help, that you need support, and you need some space to be able to talk about what it is. But the research makes a massive difference.
COJA is a community development organization that works to reduce issues around health inequalities among ethnic minority communities. Through our work in advocacy, we pioneered the research in looking into the issues that ethnic minority are going with regards to mental health. We found that coming from different cultural backgrounds, they had different issues and different understanding of mental health. Within the Balbriggan Women's Development Group, they identified and still identify the issues of mental health with isolation, racism and discrimination, issues around language barriers, low-cost counselling services. These are all barriers to women seeking help with regards to their mental health.
Project here, it seems like my family in Romania.
Yes. What we need to do, especially the health service, needs to take the recommendations quite seriously to improve information around mental health within ethnic minority, improve access and use of services, mental health services, sort of influence mental health policy in Ireland and help ethnic minority participate in that process.
Your thinking is distorted. Your whole perception of reality is distorted. It's not so much a, wanting to be thin as like an eradication of the self. And certainly I kind of just wanted to get rid of me. I'd become, obsessed with food, but I'd also become very disturbed by food. When I kind of lost that much, I went into PATS. And I went into the adolescent service because it's an incredibly frightening thing to be going into, like a psychiatric hospital as a teenager. There's this kind of expectation in, Ireland and in mental health services that, men don't talk about their problems. Men are expected not to talk about their problems. They're expected to bottle things up. And there's an expectation that women, are much more comfortable talking about their feelings. And I never did that. I was always much more of a bottler. I remember waking up every day during that period and just often having panic attacks, wishing I was dead and really, really wanting to die at that stage. This is one of my many journals that I've kept over the years. I still keep them and I always have, but it's very interesting because it's kind of almost like a historical document of what sort of state of mind that I was in. I had just turned 18. So I starved myself and was put back in hospital, but this time I was in the adult ward. It got to a stage where I was dying and they were, my heart had to be monitored twice a day. And I just realised that there was something really tragic about being 18 years old and dying. I got sick when I was maybe 16 and now I'm only beginning to become myself again, in the last couple of years. There really needs to be an assessment done on a personal basis because, it's not easy not fitting into the treatment that's prescribed to you. It's really not. There needs to be more of a dialogue. There needs to be more of a dialogue created about what it actually can be like to live with these things or, struggle with these things. Because there's not as much homogeny as people would hope or like there to be.
Typically, the literature and research would tell us that females are 3 times more likely than males to experience things like anxiety, low mood or depression. Oftentimes, while these are generalisations, it's thought that women are more likely to internalise mental health distress, so experience that stress or anxiety or low mood, whereas men engage in behaviours which are more lethal and use methods which are more lethal, and so are taken very seriously and very significant. And as I mentioned, young females or females in general are more likely to engage in cutting and overdosing, which oftentimes may be less lethal and therefore, in my experience, can sometimes be somewhat more likely to be dismissed by those in the systems around those. That distress is very, very real, and I think it's really important for young women that we don't negate their experience and dismiss it and say it's just a cry for help. If someone's looking for help, let's give them that help. Young females in Ireland actually had the highest rate of suicide in Europe, so 15 to 24-year-old females. So that's shocking, that's unacceptable. So it's very important that we don't see all young people as one big homogenous group. While there are similarities, there are differences as well. So that would be something that in terms of research, which would inform policy and practice, would be very helpful to consider mental health through the lens of gender.
I got pregnant for the first time when I was 32, and I was with my partner, and now my husband. Pregnancy was very much planned. It was something that we wanted to do. When I first told him, I was very excited, but then as the first weeks of the pregnancy progressed, I had a feeling of unreality. You're laying on the table and they're scanning your belly, and you see the video of it on the screen, and I thought, if I see that video, I will feel something. And I felt nothing. There was a baby growing inside of me, and then there was this other thing, this black mass of pain that was sitting there, and I couldn't get rid of it. Every time I went for one of my appointments with the GP or in the hospital, I would say to the doctor or the midwife, I don't feel great. I feel sad. And they would generally just say, oh, that's normal. It's normal to be a bit hormonal in pregnancy. I wouldn't worry about that. Nobody ever seemed to notice that I was sitting there crying through every single appointment. The way I felt was that I wasn't a person. I was just this bump. I was just this carrier for someone else and who was more important than me. I wanted to not be pregnant anymore, or not be me anymore, or not be here anymore. And what I did was the best thing I could do to get out was I got out of the house. But I was wearing my pajamas at the time, and I was barefoot. And I just walked out of the house and out across the road, across this big, busy roundabout, not really caring if there was traffic on the roundabout or not. Then I walked back and I sat down on a bench outside of our apartment building, and I just sat there and cried. My partner, he came with me the next time, and the doctor came in and she looked at the bump, she looked at the baby. She asked me how I was doing, and I said, well, I'm not feeling great, I'm kind of sad. And she looked up from her chart and she said, I hear you. You need help, and I'm going to get you some help. And she saved me. Sorry. Yeah. And she got me an appointment with Dr. McCarthy, who's the psychologist in Holles Street. So then I started seeing him for the rest of the pregnancy, which was about the last 12 weeks or so, 10 to 12 weeks. And he got me on medication, and I was able to start enjoying things, enjoying life, and being a little bit happier, and being okay with the idea of having a baby. Maybe not being happy, but I was getting there. I hope that what other women will go through isn't nearly as bad as what I went through. I hope that what will happen is now when women say that they're depressed, that they'll get referred to a mental health professional.
Pregnancy is a very vulnerable time because it makes all women more prone to depression. There is a blind spot in relation to reproductive health care, particularly in relation to mental health. We found prevalence rates of about 16% of antenatal depression, which is actually higher than international norms, which would, vary between 10 and 14%. And probably the reason for this is because of the dearth of mental health services for women during pregnancy. We've annual birth rates in Ireland of about 70,000, and we've 4 part-time perinatal psychiatrists. That means certainly probably the more severe end of the spectrum is hopefully being picked up on, but people with more moderate levels of depression are possibly and probably not been picked up and not treated. And then, of course, you need women to be screened for depression during pregnancy in the same way that you're screened for other vulnerable diseases during pregnancy, like hypertension and like diabetes. So there needs to be an attitudinal change that women who are pregnant can be depressed. They cannot want their pregnancy because they're depressed. And we have to accept that, and we have to build that into our healthcare policies.
Generally speaking, women live longer than men. One of the consequences of living longer as a woman is that over time you accrue more chronic illnesses. And so while you may live longer in terms of health, you may not have the same quality of life. Dementia is a big challenge facing us in Ireland, and women are doubly affected by dementia. In fact, currently 2/3 of all people in Ireland living with dementia are women. We did a study of 200 carers in Ireland who were caring for a spouse with dementia. Number one, the majority of carers were women. Number two, interestingly, whilst the women had more social connections than the men, the women identified as feeling more lonely and being more lonely than the men. And that's a really, really important distinction to make. And we need to understand those gender differences. So an investment in research is going to be important. An investment in services that acknowledge those differences.
The National Women's Council of Ireland, we're a membership organisation, and for so many of our members, women's health is a real core priority and always has been. We feel that women's mental health is invisible. It's invisible within the wider context of women's health, but also in terms of general health policy in Ireland. Across Irish society, the experiences of women will be very different depending on their background or their ethnicity. We need to see research in terms of traveller women, for example, women in direct provision, LGBT women and women with disabilities, so that we can clearly see what are their needs and what the responses should be. We're coming from a place that we would prefer not to be. We have seen in Ireland, particularly in recent years as a result of austerity, a cutback in terms of services that are there for women. So the fact is the National Women's Council is the only organisation now really looking at women's and men's health needs differently and looking at the services that need to be put in place in response to that. A critical area is also on access to abortion services in Ireland, because we've seen very clear evidence in terms of the impact on women's mental health because women have to travel for abortion and also because of the shame and stigma that surrounds abortion in Ireland. Vision for Change is currently being reviewed. That's a critical place for women's mental health needs to be focused on and to be prioritised. One of the things that the National Women's Council is looking for is a separate women's health action plan. There is a similar one in relation to men, and we need to see a specific one in relation to women. It's very important for women who have been telling their stories on how their mental health has been impacted on from so many different factors. It's important that those stories and experiences get heard, and get heard in a way that's influencing the policies that are being put in place. There are solutions to this. There is a way forward in this, and it's about making critical choices.